dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz. Our topic today is about preparing a written emergency plan. My guest is Chelsea St. George. Chelsea is the Public Health Emergency Preparedness Coordinator for the Greater Nashua Public Health Network out of the City of Nashua's Division of Public Health and Community Services. In her role, Chelsea is responsible for the planning, organizing, training, exercising, and administration of public health emergency preparedness activities, including pre-emergency planning, emergency response and coordination, and post-emergency recovery coordination. She also coordinates with the State of New Hampshire Division of Public Health Services to strengthen public health preparedness planning and response capabilities. Welcome, Chelsea.
Thank you so much, Yvonne.
Thank you for all that you do, and I really appreciate the fact that you're going to talk today about the importance of having a written emergency plan.
Yes.
So let's talk about why is it so important to have a written emergency plan?
Well, as you know, Yvonne, it's important to have an emergency plan in general. You talk to your family and your household about how you'll leave in case there's a fire, about all of those emergency contacts that you should have in your phone. But nobody really writes it down. And one of the things that we're trying to do is to get people to sit and make that plan together. This plan has a number of things in it that are very important for households to have on hand in event of an emergency. And this information isn't always found afterwards.
So what's the best way? First of all, let's talk about the best way of getting that information together.
Yes. You are very lucky because you probably have most of it already. Many of the things that we include in our plan are just basic contact information, phone numbers for your child's school, the number for your doctor or your primary care provider, any special dietary stores that you might need to go to.
Police, the non-emergency number as well as the emergency number, hospital number.
Absolutely. So all of those numbers that you probably would look up in a phone or online, you're just writing them down. But we also have additional information that we like to include in written plans, and that's your insurance information, your medications, and copies of your prescriptions and medical orders. A lot of times these things are overlooked, and so writing them down and having them handy is very important.
And updating them along the way.
Absolutely. And people don't really think about their prescriptions or their medical orders or those types of insurance information being written down in a plan. But if an emergency occurs or if a disaster strikes your home, you might lose all of those documents. And having the ability to have it in a central plan and being able to take that plan with you and having it with you no matter what, you're guaranteeing that you'll have that information later.
So it would be the policy name and number.
Absolutely.
And the person that is responsible for it.
Your policy holder.
Exactly. Any other information related to insurance? Because sometimes people think, oh my goodness, when am I supposed to make a copy of my whole policy? No.
No.
You just need the basic information.
Yes, absolutely. Just your basic policy number, your primary card holder, any dependents that might be under that insurance as well. But we talk about not only home insurance and auto insurance, but making sure that medical insurance is there as well.
It would be helpful also if they have a living will, if they've done that.
Absolutely.
And their information related to if anything should happen to them for a healthcare proxy, that they have that information too with that.
Absolutely, Yvonne. And we do stress that you should have copies of those important documents in your emergency kits, both in your state kits in case you're going to write it out at home, or if you need to evacuate, putting it in a go bag. So a lot of times people can make copies or put it onto a thumb drive or a flash drive and easily take it with them.
Okay, so what should be included in an emergency kit?
Oh my goodness. Well, in addition to water, food, medications, you should have 3 days of medication for everybody who takes prescribed medicines, as well as copies of those prescriptions and medical orders that I talked about. But you should also have any durable medical equipment, such as, a walker or a spare cane that you might be able to stow away. Or if you're perhaps in a wheelchair, maybe having something a little bit more portable. So in the event that you actually had to leave, you would be able to have mobility wherever you went. So making sure those medical equipment that we talk about, that you use every day, that you bring those with you.
And that it's easy accessible.
Easily accessible, yes.
Okay.
It doesn't have to be fancy, it just needs to work.
And that's another component of, in this go-to bag that you were talking about, people also have a kit besides that in their home, in their cars.
Yes, you should.
And what are the types of things that they have there that would be health related besides the things to keep them safe and warm and help them in case of an emergency?
Well, I always suggest that it's very helpful to keep an extra pair of glasses in your kit, especially in your vehicle. If you get stranded somewhere, you might lose your glasses, you might have contacts and can't wear them. Keep an extra pair of glasses on hand.
And what about medications, just in case? Should people
Yes.
have backup of medication in their cars in case they get stuck and they're not home in a given time?
Yeah. Well, it does depend on the medication. Not
Correct.
all are temperature
Exactly.
stable.
Yep.
So if you can have a few medications on hand, especially those very important ones that you need to take every day,
Yes.
that would also be very helpful.
Okay. So in this plan, you talk about also special diets. If people have special diets, what are the types of things that they should have available for them?
Right. So a lot of times when we build emergency kits, we like to put the granola bars and canned goods and those types of easy foods that are very accessible and stable. However, if you have gluten sensitivities, allergies to nuts, soy, those products might be a little bit more difficult to have on hand and to find. So we do urge people to try to find foods that fit their specific dietary needs and customize their kit to make their needs met.
And again, update them accordingly.
Yes.
And also have within your car and your vehicle that you travel, not only that go-to bag in the home that you need
Right.
with everything, but in the car also.
Absolutely. And if you can, maybe at a place of work. You spend most of your day at work, so if you can have a kit ready to go at work, you're that much more prepared.
Now, in the work situation there, do work environments have kits themselves that they have available for their employees in case anything should happen in an emergency?
Some places do, others do not. It really depends. But we really want to urge organizations and businesses to try to encourage their employees to take those steps themselves.
Exactly.
I mean, a lot of people have that snack drawer in their office or in their cubicle, maybe putting a couple of other things in there, like a change of clothes or, one of those battery packs for your cell phone in case power goes out, and keeping a copy of your plan there as well.
Excellent. And the plan, the best way to write that plan and then to disseminate it, get it out to the
Yes.
family. On a computer, develop a plan, or just write it down and make copies? Or
Either will do.
Okay.
We do have a number of plan templates that we have on our city website.
And where would people go for that?
Okay, so it's nashuanh.gov-dphcs, and it's on our website there. There are links to templates that you can fill out online and print out, or you can come into the division, and we have a number of templates that have already been printed, and you can write them out together.
So on the templates, you're familiar with them.
Absolutely.
Can you describe what's on those templates?
Absolutely. So we'd like to start off with all of the family's information. Who's in your household?
So their names,
Names,
date of birth,
even sometimes social security numbers.
and why is that?
Well, again, for insurance claims and those types of matters, you're identified through the government with your social security number.
Okay.
So having that number on hand, if you don't have it memorized, is also very helpful.
So we start with all the names, the date of birth, social security numbers, and what else?
Also, we like to put all of those contact information for your primary care provider, any special provider that you might have for a disability or a disorder. Also, we like to include the number for the pharmacist that you regular,
Okay.
and any other healthcare facilities that you might go to. Want to include the information for them as well, like a chiropractor, for instance, or a dentist.
All right.
We also like to have an out-of-state contact. Now, an out-of-state contact is a single point of contact for everybody in your family. You let them all know that if there is an emergency and we can't communicate with each other, you should call this one person. And we like them to be out of the state because they're out of the area.
Right.
They're out of the area, they're out of the initial area that's impacted. They might not have damaged phone lines, and they'll probably be okay. And during an emergency, it's very difficult to communicate with cell phones. Cell towers will be very busy. It's very difficult to get a cell phone call out.
Or text, you could text, right?
Yes, text is best.
Yes.
Text messages require just very little bandwidth, and it's a lot easier to get those messages out in the event of an emergency than an actual phone call.
And if people didn't have that ability of texting or cell phone, what would they do?
Well, we always stress the importance of that landline.
Okay.
If you have a landline still, that's an incredible asset to you.
And why is it important to have a landline?
Well, again, everybody's so reliant on their cell phones.
It's very true.
If
Many people have done away with all their landlines.
They're transitioning. So if you can keep on to that landline, if it's just a low cost every month, have it wireless. So that way you can always try to get through. If you don't have a cell phone, then you can always try to get one of those prepaid cell phones, like a track phone.
Okay.
And
Where can somebody get that?
Oh, you can get it over the counter at a Walmart, or I think many convenience stores will have them as well.
And it's a pre-packed cell phone.
Yep, you buy the minutes and you hold on to them until you need them.
Excellent. That's a very important thing. Now, I'd like to take with that list of the names of all your household members and your family members and expand that just a little bit.
Yes.
It'd probably be helpful, would it not, to also include numbers such as the place of work for each person,
Absolutely.
a best friend that they might sometimes stay over or
Right.
be with. Important numbers.
Important numbers. Thank you so much, Yvonne. We like to include the schools that your children go to and how to contact them as well. They might have
Babysitter information.
babysitters. And we'd like to also include information about those people who might be in your emergency support network.
There you go.
The people that will be there to help you in an emergency, your best friend's phone number, the neighbors, whoever you would rely on for help,
Okay.
you want to include their information as well.
So that information, in a sense, could end up being about that much.
Yeah, I actually have a little card,
Okay.
and it all fits here.
It does.
Yep, it folds out. You have your school's information. You have your family information with the dates of birth.
Okay.
You have an emergency contact and your out-of-state contact.
Very good.
That person that everybody's talking to and making sure that they're okay. And it all fits right here. You have a place even for your insurance information.
Very good. And that can fold up, and you can put that into a little plastic pocket or something.
put
and
it
you
in
can
your
carry
wallet.
Wallet, purse,
Yeah.
right,
It's
everywhere with
perfect
you.
for your wallet. It's great for a child's backpack.
Excellent.
It's always on their person.
And that's a template that you have that people can
Yes.
download and
Yes.
print off.
That is also available on our website.
So what about, we've talked about the special diets, the medical needs. What about the disabilities to make sure if people have equipment that they may need
Absolutely.
in order to get around? Now, what about for languages, people who speak different languages? What are the recommendations?
Yes. So we do have a high population of individuals in our city that come from a various background, and they speak a number of different languages. And it's impossible for me to know all of them.
Exactly.
So we do rely on people developing that network, that support network. If you don't feel comfortable speaking English or Spanish in our city, we encourage them to find somebody that they can trust and rely on to be in their emergency support network and help them interpret the information that we give them.
So they have it on that list.
They have it on that list as well, yes. Also, things like Google Translate or another translation app on a phone also is helpful to have. Even a dictionary. A simple translation dictionary can make a big difference in a pinch.
What about emails and social media?
Oh my goodness, emails and social media are great ways to get the information out.
So how would people do that, and how would they take that information and put it on their emergency preparedness?
Well, if you have key people that you would like to contact, you can make a list and put either their Twitter handle or their Facebook page, the name of their page, and you can be sure that you go down your list and you check off who you've talked to. Or another thing that Facebook now does is they will ask you if it's a large incident, are you okay? They use the geolocator on your phones and they can ask you, are you okay?
How does that work?
I have no idea.
All right, then. That will be
It's very
something we need
fancy.
to follow up on.
Yes. So in large incidents, like over in France, a lot of
Yes.
people were able to check in with their families across the world in an instant by simply clicking, yes, I'm okay,
Through Google,
through Facebook.
through
Yes.
Facebook. Isn't that amazing?
Yes.
Now, what about for pets and other loved ones, service
Absolutely.
animals?
Pets are very important, and for a lot of reasons, people don't like to leave their pets behind. I have pets. I'm sure you have pets. We all have pets, and we all have those four-legged friends that we like to call family.
We love. They're part of our family.
You don't leave them.
No.
You don't leave them. So if you do need to leave your home, you need to plan for how you will take them with you, and make sure that they have a bag as well,
Right.
with their favorite toys, a dog bowl for water, extra food, and some
You have
treats.
a crate that you can put
Crate.
them in, because if you have to go to a shelter or whatever, if you have the animal in
Yes.
a crate, that's helpful.
Yes, it's very helpful. Maybe a very familiar bed. Those things were also important to take with you. But it's also important to remember that not every hotel, many people will go to a hotel
Yes,
or a shelter. Not all shelters and hotels are pet friendly.
that's true.
So it's important to also include information for your veterinarian if you do have animals, and also a local kennel that might be able to help and shelter your animal if you need to leave. So if you can plan with them, the people who take care of your babies, on a daily basis, regularly, if you can plan together with them as well, that's also one step closer you are to being more prepared.
And you work as a team with our regular emergency management system
Yes.
within the city of Nashua with Justin Cates, who oversees it all. And so you focus on the medical aspect,
I
the
do.
medical and the health, and he focuses on overseeing everything.
Almost everything else.
And people can learn what should be included in an emergency management kit in preparing by going to the Health View and looking up at YouTube and looking up the program that I did with Justin Cates.
Yes.
It's very, very informative.
Yes, it is.
And in addition, through the aspect of this, through health, what are the other things that people need to know in order to have the information needed to help them make good decisions related to this?
So you want to make a plan for where you will evacuate if you need to.
Where you'll meet and
Where you'll meet. So there are times when it's okay to shelter in place, ride out whatever is happening, and you can really stay close to home and depend on your support network and the caregivers that you interact with daily. But in times, you will need to leave your home. And if you can identify a place that's outside of the area where you can go, that maybe isn't a shelter, or maybe isn't an emergency housing unit, that's more suitable to your needs and more comfortable, that's one thing that you can do.
Would you have any recommendations of some ideas that people could consider? Would that be another friend, a family member that lives out of town?
That's great. If you have friends outside of town, if you have family members, those are all wonderful places to go.
Okay.
They're your first place that you should go.
All right, then. What else that we need to tell people?
Well, children.
Yes.
We've talked about our four-legged children.
Right.
But if you have children with special needs as well, you might want to reconsider where you go. Shelters might not be the best place for your family to be, and having a plan written down with who you will go to and when is very important for that planning process. And talking with your children, especially about your plan, is another component that we
And
need
practicing it.
Oh my goodness, of course, and practicing. I think we can all remember those days where you'd have your fire drill and go meet at the mailbox or
Right.
at the fire hydrant. But what happens if that's not safe? What if you need to go to somewhere else in your neighborhood? Maybe it's the stop sign at the end of the street. Or if that's not safe, maybe it's a church or a community center or a very familiar area that you all know, maybe a park. Knowing those locations ahead of time will help you reunite with your children, and also making sure that if it's during the school day, you know what your school's emergency plans are to help you get in touch with your children and reconnect.
And also, it's good to have a backup emergency plan
Yes.
related to where you meet too, because if that first place that you put is not able to be located, you at least have a second and a third that you know that you'll go to.
And oftentimes this can be relatives, it can be a friend's home, it can be one of those people in your emergency support networks.
And just making sure that they're there before you head out and
Yes.
start going there.
Yes, absolutely.
Okay, so we've covered children, we've covered a lot of different things. So now what else might we be able to highlight for people?
Well, the one thing I do want to highlight is that you need to update your plan.
Yes, and how often should one update it?
It really depends.
And if there are any changes on the list.
It does. Well, you should change it and update it at least if your information changes, such as the birth of a new child, or maybe you've changed schools or changed your workplace. Also, if you have any changes to your health insurance or your medical information, make sure you add that as well. Otherwise, give it a quick look every now and again, at least once a year.
Do it when the clocks change.
Absolutely.
Make a point to do that while you're checking your batteries for your fire,
Yes.
Your fire protectors in the home and checking your fire extinguishers. It's a great time.
It is.
Check your plan.
When you change your clocks,
Right.
you're also going to be going through your emergency kits
Yes.
to make sure that anything that has expired is cycled through and you can replace any items that no longer will be okay in your bags.
And the medications that you
And
might
the
have had missing
medications.
and that might have changed, you'll change that out.
Absolutely. And that's the perfect time to go over your plan again.
Okay.
Again, if you have children, going over it over and over and over again is the key. Repetition, repetition.
And keeping people calm,
Yes.
not wanting them to react, but to calmly respond, knowing that they have this information that they've prepared,
Right.
then they don't panic.
And they don't panic.
They can calmly move forward and just do what they need to do.
Yes, absolutely.
Flashlights are really important,
Flashlights are very important.
critically important. And also those, Red Cross has a wonderful battery-operated radio that if you
Probably
lost touch with a
cranks.
power crank that you can take along with you.
Those are all great things to put in your kits.
Yes, and they can learn more about what to include in that kit by going to the show with on emergency preparedness with Justin Cates. But other things from a health perspective that
From
we
a
would
health
want
perspective.
them. Yes,
Well, we've gone over our medications,
yes,
medical orders, those vital documents, and we also talked about that durable medical equipment,
we did.
your special language equipment, special dietary needs, and if you have a disability, maybe any other equipment that you might need. Did we talk much about service animals?
We didn't.
We didn't. We do talk about our four-legged friends.
Yes, we did.
But service animals, treat them as your own life. You need to make sure that your service animal knows what to do if there is an emergency as well.
And how do you practice with your service animal?
Yes. So one thing that we like to do, and we like to encourage people with service animals to do, is to practice different evacuation routes. So a dog may know one way to get from work or to a familiar place, but if you're trying to avoid an area, it's very easy for a dog to become confused and not recognize where they're at. So if you can practice different routes and different ways of getting to the same place, that will also help in the long run.
That would help for everybody,
Yes.
not just the service animal. Because
Practice
if you practice different routes on getting to the place that you're going to meet.
I like to tell people, think about 3 different ways that you can get home today.
Very good. And from a children's perspective, what can help them to feel secure about this process of understanding that it's important that they have this information and to know if they're younger, the adult to go to share it so that they can get help?
Well, the first thing is to include them. You don't want to just give your child a packet and say, hey, if there's something bad, look at this. Not all children can read,
No.
and not all children will be able to understand what to do. So if you can make sure that you practice and make it fun for them, make it a game, make it some way interactive so they can maybe meet you at the mailbox.
Right.
Or say, practice calling our neighbor.
Exactly.
Or practice calling your aunt or uncle who will be going to. Those are all small things that all small steps that you can take to help get them prepared without making it alarming. But again, practice makes perfect.
Yes.
And you go back to your gut. If you practice over and over again, you'll know
Remember.
what to do.
It's very true. And with that, emergency numbers with children, practicing that, it's also, there may be emergencies that occur within the home.
Absolutely.
And if they've already practiced how to dial 911 and understand their address of where they are, and they can explain what's happening or tell, there have been many
child may save your
heroes,
life.
yes, exactly, of children that can help. So let's summarize
Okay.
important things.
First things, if you want to start getting prepared, you need to make a plan, build a kit, stay informed with those alerts and warnings that we have in our communities,
You put the plan in writing.
and put it in writing, and then get involved. So we have a number of opportunities to get involved in our city. But really, it all starts with making that plan. You need to understand what you will do, who you will need to contact, and how you will leave if you need to leave, if there is an emergency.
So starting out in that plan, you're going to put the names and contact information for all your loved ones,
All of your loved ones.
your insurance information.
Absolutely. For
What
your
else?
home, auto, and your medical insurance.
Okay. Your medication list.
And copies of any special medical orders.
Okay. And information related to your living will or for information related to a health proxy.
Absolutely. Both copies.
Okay. What else?
You also need to include the information for your child's schools, your workplaces, that out-of-state contact for who your family will contact, and also your support network. You need to include your buddy system. You're not in it alone, and we're all here to help each other at the end, right?
Okay. So you have your fire, your police information. You also have your information related to where to go in different parts of the 3 different,
depending on what happens.
depending upon what happens.
And then, of course, share it. Everybody needs to have a copy. Keep it in your home and practice regularly.
And if people wanted to get that template again, how would they do that?
Yes, so they can visit our city website at nashuanh.gov/DPHCS. That brings you to our division page, and we will have those templates up there for you.
Excellent. And also within the city of Nashua, there is Code Red.
There is.
And Code Red would be something that if you haven't already done that, it would be important to do that.
Yes.
Code Red allows everybody to be informed in an emergency, what to do, where to go,
Yes.
and what you need.
That is your trigger for action.
It is. It truly is. So if you haven't already registered for Code Red, be sure that you do, and you'd go to Nashua to do that.
nh.gov, yes.
Thank you, and have a wonderful day.